It's a great background to have that in mind when I'm going to talk about having a field hospital out in a war or conflict or whatever you are going to call the situation in Afghanistan right now. It's a very difficult, a very different way to look upon, be a medical service in a conflict like that, and I'll take you through some of the ethical dilemma you can have as doctor thinking when you take that chance to command a field hospital in Copenhagen. First, a little bit about my background. As you can see, I started my, you can say, professional career by being a conscript in the army in 1977. At that time, I was not pretty sure what I should spend my life on, either be an officer or a doctor. I decided at that time to study medicine. The paradox is that if I was a young man today, I could be attracted to stay in the army, because nowadays the Danish army are used for something that was actually meant going into a conflict. That is a strange situation to think about, that I really want to go to war. But on the other hand, you should also be aware of, if you have the army, there will also be a possibility that you actually will use your professionalism. And that is one of the first conflicts you can have as a human being. First of all, to deal with military, and on the other hand, also be willing to use that force in case it is necessary. In 2007, I decided to change my civilian position as consultant doctors at Gentofte Hospital to be a commander of Danish Field Hospital. As you also can see on the two pictures, when I was a doctor, probably you can't see it, I wear a little moustache that's normally used for officers. So at that time I probably have a little bit of officer thinking. And when I became a commander of the field hospital, I took off a little moustache, whether to look a little bit more like a doctor. My agenda for this presentation is that, first of all, I will give you a little talk about what is actually a field hospital. Sometimes I met some confused about what is a field hospital. You have heard a definition from the Red Cross what a field hospital is. And in many minds, a field hospital is like what you have seen many years ago in the TV series MASH, where you see a lot of tents spreading out of an area, and also you are thinking a little bit of catastrophe, a lot of patients, casualties coming in constantly, and a little bit of chaos. I will show you what a field hospital is today. I'll give you a little bit of data what we actually did in Afghanistan when I was deployed, and at last, I will come into the real topic, ethical consideration I have. First of all, before I deployed, also what kind of ethical dilemmas did you have during your deployment, and what are you thinking about today after have been deployed? First of all, you should say that a modern military hospital, I'll not call it a field hospital, and I'll also recognize that the British are not calling it a field hospital, we are calling it a hospital. I think they might do that because they want to say that a hospital, a field hospital today is a very, very high standard of trauma care. And that is what I will later on show you a little bit of dilemma when you are going to compare the situation in Afghanistan, where you have a very modern trauma care there compared to the situation you have in Afghanistan. You should also be aware that there are only one reason why there is a hospital. That is that the military are there. There are an armed conflict, and they are involved in that. But also you should be aware that even though you can discuss whether the Geneva Convention had to be applied in Afghanistan right now, you should still think as a commander of a hospital that you are under the Geneva Convention. I'll not say very much about the dilemma you have, but some are stated, or some political are stated, but right now the Geneva Convention have no rights in the conflict in Afghanistan because we are not in war with Afghanistan. We are invited there by the official government in Afghanistan, and that's why we don't have to obey the rules based in the Geneva Convention. That is a little bit of discussion of the discussion. Instead of, as a commander, you should, in a hospital there, obey to the Geneva Conventions. You can see here the outlook of the field hospital, or the hospital in Camp Bastion. And that's the building here. And you probably will think that will be more like a field hospital, the tent there. The tent there is where the personnel to the hospital are sleeping, and the building here are the hospital. And that hospital was situated in the middle of Helmand province in Afghanistan, middle of the desert, and it was the inside of that was very modern, and you have all the equipment you can imagine you should have in a modern trauma care setup. This one slide here is to mention that we actually in the conflict there have a rule of engagement. That is the ISAF. The ISAF stands for the International Secure Armed Forces, and the ISAF is the way we mention the coalition in Afghanistan who take parts of the conflict there. Nine-liner means that you have an alarm call out from the field. And it is Army as national forces, and that means the locals who are require emergency care, we are admitted to our facility. If we are not emergency, if it's not a local army forces, and it is what you will call civilian who are injured because of the conflict or because of the battle out there, of course they are admitted to our facility. If it's not had anything to do with the military activities you have in the area, and it is still a civilian, now you decided upon the matter of resources you have in your facility. And that is, in one way, triggered me a little bit about what Per was telling us. That Per's problems when he is working is access to the population. In my situation, it was probably a little bit the opposite way. It's not a question that we in many ways have the forces to go out and pick them up and find people who need medical care, but we have to regulate it in another way. And that's maybe also could be a question for me later on, how we do that and how you are thinking in that way.